Good morning, class. My name is Nancy. Last week we learned about the structure of the skin to include the dermis, epidermis, and subcutaneous layer. We went further and learned about the function of the skin, which include protection from irritant as well as regulation of temperature. Today we are going to learn about the disorders of the skin. Disorders of the skin. Disruption in the skin integrity may be precipitated by trauma, abnormal cellular function, infection, inflammation, and systemic diseases. We're going to start with inflammatory disorders of the skin, eczema and dermatitis. There are various examples of eczema and dermatitis. The first one is allergic contact dermatitis, irritant contact dermatitis, atopic dermatitis, stasis dermatitis, and seborrheic dermatitis. Allergic contact dermatitis. It's a T-mediated or delayed hypersensitivity of type 4. Reaction to irritant, allergens. These allergens release cytokines and chemokines. Allergens such as microorganisms, foreign products, drugs, metals, latex, and the manifestation of this allergic contact dermatitis include erythema and swelling of the skin. Treatment always is removal of allergen being the vital for resolution. Let's open our textbook page 1506, figure 47.5. It really shows a nice illustration of this kind of reaction. Irritant contact dermatitis. They are non-specific, caused by activation of innate immune system by pro-inflammation properties of the chemicals. The intensity of the inflammation is related to concentration of the irritant, exposure time, disruption of the skin barrier, and age. Similar in appearance to allergic contact dermatitis. Removal of the source of irritant is very vital. Use of topical corticosteroids and petroleum-based emollients are effective treatment. So you find that they are almost close together, the allergen and the irritant dermatitis. Do we have any questions so far? Atopic dermatitis, atopic eczema. Common in infancy and childhood. Prevalence is 25% of children and 2 to 3% of the adults. Onset is from 2 to 6 months. Most cases occur within the first 5 years of life. Most individuals will develop allergies and asthma in life. Rash will appear in the face, scalp, trunk, and extremity of arms and legs. Lichenification. This is the thickening of the epidermis from constant scratching of the skin. You find that these little ones will be constantly scratching their skin, and it forms a thick layer. And it's going to vary depending on, the site of scratch. Itching interferes with sleep and causes irritability. Avoiding of triggers and promotion of skin hydration are effective treatment. Stasis dermatitis. These occur more on the legs, result from venous dermatitis and edema. Pooling of venous blood traps leukocytes that may release proteolytic enzymes. Increased venous pressure leads to disposition of red blood cells, fibrins, and other micromolecules. Clinical manifestations include erythema, pruritus, scaling, petechiae, and hyperpigmentation. Progression will lead to stasis ulcers. Stasis dermatitis results from venous stasis and edema. Treatment include leg elevation, refrain from tight socks, clothes around legs. Compression stockings are always very important. Infection can be treated with antibiotics. The chronic lesions, you use moist dressing, external compression dressing, and vein ablation surgery. Seborrheic dermatitis. This is the last form of inflammatory disorder of the skin. It is common. Chronic inflammation of the skin involves scalp, eyelids, ear canals, nasolabial, axillary, chest, and back, and the back. In infants, it is known as cradle cap. Pay attention to the bolded words. Lesions occur from infancy to old age with periods of emission and exacerbation. Lesions are greasy, scaly, white, yellowish plaques with mild pruritus. Topical agents such as ketoconazole, coal tar shampoo, corticosteroid are the first line of treatment. You can as well open your books on page 1507, figure 47.7, and it shows a really nice diagram of seborrheic dermatitis. If you don't have a textbook, you can sit close to someone that has the textbook. Okay, let's continue. The next type of, or rather the classification of skin disorders is papillospomous disorders, and examples include psoriasis, pityriasis rosea, lichen planus, acne vulgaris, and acne rosacea. Psoriasis, chronic relapsing proliferative inflammatory disorder. It involves the skin, scalp, and nails. Affects 1% to 11% of the world population. Onset is by the age of 40. Triggers include physical injury, infection, and medication. It's a T helper mediated autoimmune disease. And I would like you guys to read about the treatment of psoriasis. Pityriasis rosea, self-limiting inflammatory disorder, common in children and young adults, caused by herpes-like viruses, begin as a single lesion known as Ehrach patch that is circular, demarcated, salmon pink, and is approximately 3 to 10 centimeters in diameter. Usually located in the trunk, early lesions are macular and popular. Maybe few to hundreds of the lesions. Patterns of distribution follows the skin lines around the trunk and resembles drooping pine, like a Christmas tree. Treatment include UV light, antihistamine, topical corticosteroid, which actually helps to control the itching. Lichen planus. It's a benign autoimmune inflammatory disorder of the skin and mucous membrane. Onset begins between 30 to 70 years. Begins with non-scaling purple-colored flat-top polygonal pruritic papule, which is around 2 to 4 centimeters in size, located in the wrists, ankle, lower leg, genitalia. New lesions are pale pink and evolve into dark violet. Oral lesions appear lacy with rings that must be differentiated from oral candidiasis. Treatment include topical corticosteroid, antihistamine, narrow band of UV light. Acne vulgaris. Inflammatory disease of sebaceous glands, contagious with hair follicle, affect areas greatest amount of sebaceous follicles such as chest, face, and the back. Cause is unknown, possibly genetic predisposition, excess sebum production, hormonal dysfunction, proliferation of P. acne. Factors associated with flare-ups is stress, menstrual cycle, smoking, medication, and environmental exposure. There is very high incidence in adolescents. That you've seen those adolescents, you can see some of these acne vulgaris in their faces. Physical findings are red swollen area around infected follicle, oily thickened skin, visible scars. Treatment can be individualized according to severity. Acne rosacea is a chronic inflammatory disorder of the skin, primarily in the middle-aged adult. Cause is unknown, involves adaptive and innate immune response. Chronic sun exposure, heat damage, alcohol or hot beverage, mental stress. It is characterized by edema, papules, pustules, occurring most in forehead, nose, neck, cheeks, and the chin. Photoprotection such as sunscreen or protection clothing is essential. treatment is metronidazole as the lake acid are used. When you go back to your textbook again, page figure 47.13, you will see an example of acne rosacea. The next class of disorders of the skin is vesiculobular disorders, and these are mainly characterized by vesicles and blisters. It's characterized by vesicles and blisters. Example is pemphigus and erythema multiforme. Pemphigus means blister or bubble, just like the way you see water bubbles. Pemphigus. It's an autoimmune, genetic predisposition, environmental influences, and it is common around 40 to 50 years. The next class of vesiculobular disorder of the skin is erythema multiforme. This is the inflammation of skin with minimum or no mucous membrane. Involvement, there's no actual involvement, there's no systemic involvement. It is associated with T-cell mediated type 4 hypersensitivity reaction, microorganisms such as viral infection, like Epstein-Barr virus and herpes simplex viruses. It is common in children and adults. It is characterized by bullseye or target lesion with central dusky region, surrounded by concentric rings of alternating edema and inflammation. I'm going to have some homeworks for you because next week we're not going to have a class. So I would like you to read about the disorders of the hair, alopecia, hirsutism, disorders of the nails, paronychia, onychomycosis, and I want you to, read about these disorders of the hair, and I want you to give me that homework next week when we come up. Not this week, but the week after. If you have any question, you can always meet me at my office, or we still have a few minutes, so you can talk to me in class. Thank you very much, and I'll see you again later.